for people who are, the term we've been using is vaccine hesitant. Another term is the wait and see approach. What type of skill sets in terms of talking with trust and empathy are you seeing being most successful in terms of really opening up that conversation and having people really feel like they're in a safe place to talk about why they haven't gotten the vaccine, and then to come back and give them the information so that they may decide to get the vaccine, and really moving beyond the facts to really a style of conversation. I think this can be really helpful for Ziff Davis colleagues who may know someone out there who they care about, who is really just on the fence or adamantly, scared or afraid. I know we have had some responses here in the Q&A box about someone feeling very anxious and too anxious to get that vaccine.
I think we need to divide. The term is vaccine hesitancy goes all the way from what you're saying is somebody who's maybe still trying to make a decision, all the way to somebody who says, no, I will not get vaccinated no matter what. And I think we can't lump everybody together. One thing that we've done here at Grady that has been really interesting and very highly effective working with minority populations, African American, Hispanics, is we put a place that we call it the no shame zone. And the reason I bring that up is because a lot of times people that we're going against people they're hesitant or waiting to be vaccinated, sometimes they're getting shamed way too much. They're getting blamed. Even I would frankly say when, CDC director said this is a pandemic of the unvaccinated. Well, I felt like saying it's always been a pandemic of the unvaccinated, right? Even before we had vaccines, it was a pandemic of the unvaccinated. So
right.
We should not be shaming people. We need to understand what their things are, what their thinking is. So one of the things is to listen, to ask, and to wonder, why are you having questions? Why are you anxious? Why are you hesitant? What are the things? I have found that a lot of times today, one of the biggest challenges we have, Arifa, is not lack of information, but it's excess of misinformation. And sometimes you need to hear what people have heard or what people have heard as concerning, and then you start talking to them about, okay, let me try to debunk some of those concerns that you have. The other day I was talking to somebody, and it's a woman, and she was anxious about, she stopped me, and I told the story in social media. I was at the market here near Grady, and this woman looks at me and says, "Are you the guy that talks about vaccines on CNN?" I said, "Yes." And she says, "Well, I have 2 kids." This woman is 70 something. She's got COPD. She doesn't want her kids around because the 2 boys have not been vaccinated. They're in their 30s, but they don't want to be vaccinated. And she says, I tell them not to come to my house because I don't want to get infected by this virus. Would you be willing to talk to them? I said, absolutely. And so she gets on the phone and she calls me. It turns out the boys were at home. So I had to wait there with her until they came over, but we started talking, and both of them were concerned about sterility. They had heard that if you get vaccinated, your testicles are gonna collapse and you won't be able to have children afterwards. And I had to explain to them that was not true, and I had to tell them what the evidence was. And then after that, they turned around to their mom and they said, "Okay, fine, we'll get vaccinated." And then I rapidly, using my phone, try to find a place we could get them vaccinated right there and then, because they had just made that decision.